Hey guys, today I'll be talking about hypertension, its risk factors, and the normal mechanisms present in our body to maintain the blood pressure. So, what is hypertension? We all know that it has something to do with the BP, the blood pressure. So, blood pressure is the pressure exerted by the circulating blood against the walls of the blood vessels. And this BP is usually expressed in mmHg, and we have noticed that a larger value is expressed over the smallest value. So what is the largest value? It is nothing else but the systolic BP. It is the pressure exerted when the heart contracts. So what happens when the heart contracts? More amount of blood is being pumped and hence more blood pressure. That's why it is having the largest value. And the smallest value is nothing else but the diastolic BP. It is a BP when the heart relaxes, or the BP exerted between two heartbeats. Now, what is hypertension? So, as the name suggests, hyper, something more than the normal value. So, we should know what is the normal range of BP. So, the normal range of BP is nothing else but 120/80 mmHg to 139/89 mmHg. So this is the normal value. So now we can say that hypertension is nothing else but the BP greater than 140/90 mmHg. That is, hypertension is a medical condition in which the sustained systolic BP is greater than 140 and the sustained diastolic BP is greater than 90 mmHg. So what's happening in hypertension? In hypertension, the peripheral vascular smooth muscle tone is increased. When this gets elevated, the arterial resistance also gets elevated. At the same time, the venous system capacitance decreases. These are responsible for causing hypertension, that is, elevation in BP. Next, what are the factors responsible for causing hypertension? Let's look into that. Age is one important factor. That is, as the age increases, the chance of causing hypertension is also high. That is, the most commonly affected population is the elderly population. Next factor is smoking. Yes, smoking is injurious to health. Similarly, smoking is one main factor for causing hypertension. Next, we have the comorbid conditions. That is, a person who is having diabetes, any kind of disability, or an obese patient are much prone to develop hypertension compared to the normal population. Next is sodium. That is, with high dietary sodium intake, the chance of causing hypertension is even more higher compared to the normal one. That is, when there are certain people who take more amount of sodium in their diet, that will contribute for the development of hypertension. Next is the family history. A person who is having a family history of hypertension has high chance of developing hypertension. Next is the lifestyle. That is, less physical activity or the habit of having more amount of junk foods. All of this could contribute for the development of hypertension. So these are the main risk factors that would cause the development of hypertension. Once again, that is the elderly population, smoking, comorbid conditions such as diabetes, obesity, disability, then high sodium intake, lifestyle, and family history. Next, we are looking into the normal mechanisms present in our body to maintain the blood pressure. The arterial blood pressure depends on two main factors. That is the cardiac output and peripheral vascular resistance. That is, the arterial blood pressure mainly is directly proportional to the cardiac output and the peripheral vascular resistance. So the two main mechanisms that is balancing the blood pressure is the Baroreceptor Reflexes and the Renin-Angiotensin-Aldosterone System. First, we'll be talking about the Baroreceptor Reflexes. So these baroreceptor reflexes are usually governed or influenced by the sympathetic nervous system. So don't get confused with the parasympathetic nervous system. For that, easy to remember, sympathetic nervous system, that is sympathy, emotions, that is flight or fight response. So what usually happens when we are frightened or we have something danger happening? Our heartbeat increases. That is usually happening in the sympathetic nervous system. The sympathetic nervous system is responsible for maintaining the rapid moment-to-moment regulation of the blood pressure. Now, what happens when there is a fall in the BP? When there's a fall in the BP, the pressure-sensitive neurons, the baroreceptors that is present in the aortic arc and the carotid sinuses will send some fewer impulses to the cardiovascular centers that is present in the spinal cord. And this will further prompt reflex response of the increased sympathetic and decreased parasympathetic output to the heart and the vasculature. So what happens is that sympathetic system gets increased and the parasympathetic output is decreased. So naturally this will lead to vasoconstriction and increased in cardiac output. These changes will further result in a compensatory rise in the blood pressure. So we have already mentioned previously the arterial blood pressure is directly proportional to the cardiac output and the peripheral vascular resistance. So what happens when the cardiac output increases? More amount of pressure is being created. The second system is the Renin-Angiotensin-Aldosterone System. The kidney plays a very important role here. The kidney provides a long-term control of the blood pressure by altering the blood volume. So what happens when the BP falls? The baroreceptors in the kidney will respond to this reduced arterial pressure and will stimulate the beta-1 adrenoreceptors and causes the sympathetic stimulation and increases the cardiac output, hence the BP. At the same time, when the BP falls, the renal blood flow is also decreased. This will cause the release of the enzyme renin. This enzyme renin is also released when the low sodium intake takes place or when there is a greater loss of sodium. And at the same time, the baroreceptors in the kidney is also responsible for the release of the renin. Next is a stepwise process. Renin will convert angiotensinogen to angiotensin 1, and this angiotensin 1 gets further converted to angiotensin 2 by the angiotensin converting enzyme. So thereby obtained angiotensin 2 is a very potent circulating vasoconstrictor. So this vasoconstrictor is responsible for constricting both the arterioles and veins. This will further cause the increase in the blood pressure. This angiotensin 2 also exerts a preferential vasoconstrictor action on the efferent arterioles of the renal glomerulus and thereby causes the increase in glomerular filtration. What happens is that angiotensin 2 will stimulate the aldosterone secretion, which will lead to the increased renal sodium reabsorption and increased blood volume. When the blood volume increases, what happens? Naturally, there is an increase in blood pressure. And one thing to keep in mind is that all of the action exhibited by the angiotensin 2 is mainly mediated by the stimulation of the angiotensin 2 type 1 receptors. So let's just summarize. So we have discussed today about hypertension, its risk factors, and the basic mechanisms responsible in our body to maintain the normal BP. So I hope you have understood it clearly, and if there's anything, please do mail in us. Thank you.